Yeah, good evening, all, and welcome to another special episode of Respire podcast series. So, you all know this Respire is linked to lung cancer awareness, one voice at a time. So, Respire is nothing but the rising awareness to fight against lung cancer. So, today we are here. Lung cancer, as you all know, lung cancer is the most common and remains one of the leading causes of the death. And also, it's very difficult to understand. So, it falls into the shadows of focus. So today, to clear our doubts and to clarify, we have with us Dr. Satyajeet Soni, a renowned medical oncologist, and also associate professor from Mahatma Gandhi Medical College, Jaipur. Over to you, sir. Welcome, doctor.
Right. Thank you.
So it's always pleasure to have you on this platform, sir. Okay. So coming to understanding the burden of this lung cancer, sir. Why is lung cancer becoming more common, and what are the common in non-smokers also, and as well as smokers also?
So, as we all know that the lung cancer is the most common cancer worldwide. If we say the worldwide, it is first most common malignancy which it is found. If we talk about the India, at the Indian level, it is the second most common malignancy in the male patients. And if we talk about overall, then it comes at fourth number, including both sexes. And the most common risk factor for the lung cancer is the smoking only. And other than the smoking, there are the other factors which are air pollution, indoor air pollution, occupational hazards. Like these, all this can cause lung cancer. And again, there is genetic background. Some mutation can occur in genes that may lead to further development of the lung cancer.
So, when you talk about non-smokers, you were talking about risk factors. What are the common risk factors in non-smokers also?
Common risk factors currently there is a you see the pollution is rising. Air pollution is the second most common, and the indoor air pollution like elderly previously females usually use the chula exposure. There is a occurrence of the chula exposure, so that smoke that biofuel or that causes the disease. But nowadays that there is a little bit shifting in the cause of the lung cancer. Some genetic mutation can occur, which also can cause the lung cancer, which also had predictive marker. Like predictive, we can see if we can found some genetic mutation, we can target and we can treat better in better way those
Okay.
patients.
So these are also the major risk factors. That is what you're saying.
Yeah, it is risk factor. Yes, basically genetic mutation is also risk factor.
Okay. So this is what you told about understanding the burden. Now coming to the diagnosis, sir. Why is early detection is so important for lung cancer?
So, if we talk about the early detection of the lung cancer and how it helps, if we talk with if see with previously a decade many decades earlier, usually cancer diagnosed in the stage 4 disease only. Then there was very limited survival of every disease, not only lung cancer. Every disease had very limited survival. Early detection by the screening, or some patients those are aware comes with symptoms, so that we can found disease early. We can cure the disease if found in the early stage, like stage 1 and stage 2, and we can prolong the survival. And if cancer detected early, it's especially about lung cancer with screening, then mortality of due to malignancy due to cancer can be reduced by 20 to 40%. It is very remarkable data for that.
Okay. So is there any common screening methods, sir, for detection?
Yeah, yeah. This we consider as a low dose CT scan. Usually the CT scan for diagnosis purpose that contains more radiation, but for screening we have detection through the screening. We have low dose CT scan, which compared to the normal conventional CT scan, that nearly one fourth or one fifth radiation exposure is there in the with low dose CT test.
Okay. And how often it is accessible, sir? Mean to say
Is
for
it?
the patient,
It is accessible.
it is accessible. And anyways, we are talking about screening and diagnosis, sir. When we talk about symptoms also, it is patient. Symptoms should patient never ignore?
If we talk about the symptoms, the common symptoms which due to lung cancer, when it depends on the organ affected. First of all, if disease in the lung only, then it causes the cough. If patient had persistent cough more than 3 weeks, more than 4 weeks, or sometimes patient had blood in the sputum, hemoptysis, we call it hemoptysis, blood in the sputum, and persistent chest pain is there, or sudden changes in the voice also there because of some nerves go through the nearby lung. The tumor can infiltrate that nerve, so that there may be changes in the voice can occur. So these are the features जो patient should go to the doctor to and to see the whether he had anything and other symptoms which occur due to metastasis from the disease, like patient may have persistent bony pains, or patient may have some neurological features like vomiting and the seizure episodes. This should not be ignored. Because of that, these symptoms are can be due to the metastasis of the disease, spread of the disease.
So when you're talking about this voice clearance, so generally people think that it is a normal lung infection due to seasonal variation.
Voice,
How
not
common?
voice change, voice not clearance, voice change, sudden change of voice. So
Change.
hoarseness of voice it is. It can be due to lung cancer, which affect the structure passing nearby the lung, or it can be due to the laryngeal cancer also. Smokers patients also can have laryngeal cancer, cancer of larynx, which also can cause hoarseness of voice. So these are the important features which should to be discussed with nearby doctors or some specialist.
Okay, so these are the symptoms should not be never be
Should not
ignored.
be ignored.
Yeah.
Okay.
And coming to the treatment part, sir, if you talk about the innovations in lung cancer treatment, last decade, what was the evolution has happened, sir?
Very drastic changes has happened in lung cancer management. If we talk about the 2 decade earlier, then there was only chemotherapy was the option of the treatment, which has limited survival of metastatic disease, stage 4 disease. It is 6 to 8 months, 8 to 9, 10 months. Then the molecular mutation, genetic mutation, which I talked in, told you in the cause of the lung cancer, etiology of lung cancer. So genetic mutation can occur. So we can that identify that molecular mutation also by the some NGS methods, gene sequencing methods, and we can target that. So we can extend the survival with quality of life better with oral drugs only. And current scenario, last 4 5 years, 5 6 years, the immunotherapy has came in the role, which has significantly better survival with compared to the only chemotherapy which was given 2 decades earlier. So there is drastic changes happened in the lung cancer management.
Okay, sir. You talked about normal general chemotherapy. You talked about other molecular identification also. So that could be targeted therapy, sir.
Yeah, is molecular mutation which can be targeted. It is targeted therapy in the oral form also. So we can extend survival, which is 6 to 8, 10 months with the chemotherapy. Nowadays, some patient may survive up to 5 years, 6 years also with this molecular targeted.
So this targeted therapy has a very vital role in managing
Very,
lung
very
cancer.
vital, very vital.
Okay, okay. And you were saying about immunotherapy, sir. How far the role is been real, the role of immunotherapy really helping the patient?
Yes, now that is also most better in we talk in better way. The immunotherapy has longer survival with minimal side effects. Patients apprehend of mainly side effects of the chemotherapy, which can be overcome by the immunotherapy if we give only immunotherapy. And immunotherapy also can combine with chemotherapy to get more better survival in the terms of months and better quality of life.
Anyway, sir, this was a catching point. It really affects the impact of quality of life of the.
Definitely. If there is a no side effects, then obviously there is a improvement in the quality of life. Is there.
And anyways, we are talking about the treatment. How does you personalize the treatment plan, sir, for different types of lung
If you
cancer?
talk about personalization of the treatment plan, all there are many factors which depends on the planning of the treatment. First of all, the age is the most common factor to start with treatment. We call about general condition in the medical oncology language. It is called as the performance status of the patient. Performance status we grade from 0 to 5. 0 to 5, 1 to 5. It is so up to 1, 0 to we usually consider for starting with aggressive treatment, we can start. But if performance status is higher side, then general condition is not good to start with the anti-cancer treatment. So we consider a third point is to get molecular testing done first, and to decide treatment accordingly there, and stage of the disease.
As you know, sir, in India, we always talk about the accessibility and affordability. So, anyways, we are talking about treatment, all those things. What are the
Last
major barriers?
most common the factor to decide it is cost also,
Yes. So,
because of
coming to
you
that
talk
point only, sir. So, coming to that point only, sir, what are the major barriers for assessing quality cancer treatment in India for lung cancer?
uh, not for lung cancer. It is this answer is for every cancer, each and
Every
every
cancer.
cancer, because most common barrier is accessibility. And we seen that India has most common population is the rural background. Nearly 70, 60, 70% patients are from rural background, and nearly 30, 20, 30% from urban and metro cities. And you see the cancer specialist doctor and better diagnostic facilities are in the metro cities only, not at the peripheral level. So the most common is accessibility. Second most common is affordability. If patient had this all these specialties or diagnostic uh, modalities nearby, but the cost is very high, so affordability is also an issue. Not in
And
term
what?
of this, if patients comes to suppose patients come from periphery to Jaipur, so he has to travel also nearly 400, 500 kilometers. That also comes in the financial
Okay.
issues is there.
What role do this public and private partnership plays in improving corporate and this? Hmm.
So
What role they are playing?
it may help in the cost cutting of some diagnostic modalities. Most important role is here only. Here some public-private partnership. If private diagnostic institutes, centers collaborate with the government, then cost cutting can be done there. So those patients who are not affordable, or those have minimal affordability, those also can be treated well managed.
Okay. And anyways, you are talking about the patients coming from territories, I mean to say, from rural parts.
Yeah.
So, what would be the advice you give to themselves for treatment to come over here and all those things?
So, however, there is no any alternative for that. So I can't advise him ki if there is no facilities ki you take there only. But he
Mm.
should be assessed in the proper manner. He should be
Yes.
diagnosed with proper biopsy and proper staging. So investigation should not be repeated again and again. If it is already done outside, so you should not repeat it again. If it is okay, if you are seeing this biopsy is correct, then it should not be repeated. So financial burden will not be there. But for government side, I think there is a development of daycare center should be in the peripheral level, district hospitals level. So the patients once can come here or some big center for opinion, and can continue with their treatment at their daycare center developed by the government at the district hospital levels. This is my suggestion for not only for patient. Patient can't do like this. We patient have to we with facilities also. If there is no facility, then we can't advise he to do this, do that.
Mm. Okay. Right, sir. Point to be noted. And anyways, we are talking about quality of life. We already talked about impact. And what could be the psychosocial impact on the patients? How important is
Psychosocial.
mental health? How
Yeah.
does you manage?
In our institute, we usually do what we try to counsel the patients. Some patients comes with the कि मेरे को हमारे रिश्तेदारों ने ऐसा बोला है, बायोप्सी नहीं करवाना है, ये करवाना है, वो करवाना है, so disease फैल जाती है. So we usually first counsel that this is not right way. We have to diagnose the disease with biopsy only. If we diagnose the disease, then only we can treat. Then we have to give them some mental support also, and we have in our institute or the psychoncologist also, clinical psychologist also. So we if it is beyond of our approach, then we usually discuss with psycho clinical psychologist to counsel the patients. First of all, we have to the family to should be in the confidence कि नहीं ऐसा नहीं होता है. You should get treatment.
Okay, sir. Anyways, when you're talking about this, I one more, sir. This based upon your experience, what are the most common misconceptions going to the mind of the patient and the family?
Patients usually says सर मैं बायोप्सी नहीं करवाऊंगा क्योंकि लोग बोलते हैं
Mm.
बायोप्सी करने से कैंसर फैल जाता है. So it is the most common myth among the patients and the relatives also. The
Okay.
biggest issues there. Second, if we advise them for chemotherapy, if they usually don't know about the chemotherapy, the patient with cancer comes to the hospital. He thinks कि कीमोथेरेपी यार मेरे साथ क्या करेंगे लोग, मेरे को दर्द होगा, ये सब होगा. तो हम लोग उनको समझाते हैं, no, this is not the, this is usually like that other drugs we are given in the IV fluids or like this, so that part helps to the patient to get to receive the treatment. These are the
Okay.
big, little bit, but initial challenges we face with patients. And if female patient, if you are talking about female patients, then there is particularly they are more concerned about the side effects because of hair loss is the most common side
Yes.
effect with chemotherapy. So that we have to counsel them also. It will be there, but we have to treat the disease. We have to fight with the disease, and we have to win.
Sir, is there, for example, in your experience, is there any patient who's at high risk and reluctant to undergo screening? So, what advice you give to those type of patients?
We advise if high risk patient is there, high
Mm.
risk we call those who have history of significant history of smoking of more than 25 years, and currently smoker. We usually advise them to load screening with low resistant. If they are not willing for that, then we, just as earlier we discussed, what are the findings, what are the features which should not be ignored. Then we can tell them ki, these are the features you should not ignore. If you notice this kind of features, then you should at least come to the hospital. If not going under screening, and stop the smoking. We yes, stop the smoking first of all.
And one more thing, so what gives you hope or faith or to treat a patient at late stage in an entire experience?
Yes,
You want
definitely.
to?
I told you ki there is we have some molecular genetic mutations nowadays which has prolonged the survival, which was 10 months, 8 months earlier with chemotherapy, now which can be extended up to the 5 years, 6 years, 7 years. Some patients tolerate drugs very well and do survive. We have some patients which are surviving more than 7 to 8 years also with lung cancer stage 4 disease with molecular targeted therapy.
Sir, if you want to share one powerful message for our public who's with us about lung cancer, what would be
Uh, First of all, those who are smokers, please quit the smoking as soon as possible. As you quit the smoking, the risk of cancer goes down with time, not immediately, with time. And if you have finding features which can be suggestive of malignancy, please visit to the nearby hospitals or nearby physician, surgeon, or cancer specialist with features, chest physicians, that so that disease can be diagnosed in the early stage, so we can think about the cure of the disease. And
Thank you, sir. Thanks for your valuable time. This Respire podcast series is a joint initiative by Voice of Healthcare and NATCO team, sir. It's always been pleasure talking to you, and thanks for coming onto this platform and clarifying all the doubts and myths and conceptions or whatever misconceptions are there on lung cancer awareness. Thank you, sir, once again. Thank you, team.
thank you, Sundeep.
Thank you, sir.
Welcome.